Welcome everyone to the Jaye Wellness Studio. Glad you can make it. Go ahead and grab a seat because in today's video we're going to discuss Eustachian Tube Balloon Dilation. For those of you that have thought about the treatment but just a little on edge if it's something that's going to benefit you, go ahead and stick around because I'm going to be discussing a lot of what you could be expecting when going through the procedure, or I should say the treatment of Eustachian Tube Balloon Dilation. Let's pull up some footage of Eustachian Tube Balloon Dilation to give you a little bit of in-depth visual of what it really looks like here. Taking a look here at the Jumbotron, you see that the procedure uses a balloon tip catheter. Now it looks on the video here that it's a long ways, but it's actually not at all. It's inserted through the nose and into the Eustachian tube. Now once the balloon is in correct position, it is then inflated with a solution, causing the Eustachian tube to widen. This increased width can then allow air and fluid to flow more freely, relieving congestion, discomfort, and the potential of long-term damage. Now, I'm by means no doctor, just a wellness man that loves what I do. But I have mixed feelings about this procedure. But I'm going to go over some pros and cons and leave it all up to you to decide and your doctor if this is going to be the right solution for you or not. Some of the pros of Eustachian Tube Balloon Dilation is that the method is non-invasive and has few risks associated with it, making a very valuable alternative for many people. Well, additionally, the procedure does not require any major surgery, so the healing process is usually faster than more traditional forms of treatment. Well, one of the biggest benefits to Eustachian Tube Balloon Dilation is the improved ability for doctors to diagnose ear conditions and develop better treatments. Previously, many conditions had to be managed by medication, and it was difficult for doctors to understand the root cause of certain illnesses. Well, with this technique, medical professionals can gain greater insight into our medical histories and pinpoint areas where the condition can be more effectively treated.
Really?
I mean, at the end of the day, balloons make everyone happy. Kids happy, adults happy, pets happy. It's just a positive, overall happy thing. Balloons. Yep, balloons. More balloons. But on a serious note, Eustachian Tube Balloon Dilation does seem like an effective and low-risk method of providing relief to chronic Eustachian Tube Dysfunction. With its added benefits of improved diagnostics and understanding of ear-related conditions, it's a valuable alternative for many of you out there that are looking to alleviate discomfort and improve the overall quality of life. And like I mentioned before, Eustachian Balloon Dilation has very minimal risks associated with it. The recovery time can be greatly reduced in comparison to traditional surgical treatments. Many of you who receive Eustachian Balloon Dilation may be able to return to normal daily activities with no discomfort without any restrictions. So that's positive. The procedure is often quick, only taking about 20 to 30 minutes to complete, and can often be completed as an outpatient procedure, reducing the need for any hospital stays and additional medical bills. In addition, there are rarely any complications like we stated, with no reports of any patients having any adverse side effects. So I just want to calm your nerves if some of you out there that are at your will trying to figure out how to get rid of Eustachian Tube Dysfunction and you just simply can't find any other way. Dun dun dun. Now let's talk about some of the cons and some of the things that you should consider if you're going to go with this treatment. Like many other treatments and procedures, there's always going to be the risk factor and things to just keep in mind. One of the potential issues with balloon dilation is that it can be a very uncomfortable procedure for many of you out there. Not everyone is comfortable with the idea of a balloon being inflated in their ear, and for some of you out there, the procedure can cause some considerable discomfort. Like I stated before, minimal at risk for sure, but additionally, due to the amount of pressure used to inflate the balloon, there's a chance that you may feel faint during the procedure. And another con to add is that the procedure does not give you any kind of guarantee that it will be successful. And even if the procedure itself is completed correctly and the tissue surrounding the Eustachian tube relaxes, it's not always possible to guarantee that the dysfunction will be relieved completely. Some of you may still suffer from the symptoms even after balloon dilation is over. As you look here at the Jumbotron, these are some of the things that could be causing your Eustachian Tube Dysfunction and why Eustachian Balloon Dilation is not going to help you. As you can see here, the jaw can be a major conflict with this procedure. Allergies. Now, always stress that allergies is not always to blame. But if you're going through issues with your TMJ joint, several muscles in the jaw, muscles in the facial region, getting this procedure is not going to heal those circumstances at all. My personal take of Eustachian Tube Balloon Dilation is that for many of you out there, you've been suffering for many years and you're just at your wits to try to figure out, how do I get some relief in my ear? It may be something to try, but my personal opinion, there is something deeper than the Eustachian tube itself. There is a surrounding tissue and the nerves and the muscles. It's the stress response. All of these things can't be cured by just widening the Eustachian tube. It's something that we're going to have to go through mentally to solve some of our problems. Like I said, it's going to be something with minimal risk, yes, but there are things that we're going through personally, emotionally, physically, that we need to get a grasp with. Otherwise, the treatment will be not as effective and not be helpful to us. And let me put it this way. It's like using nasal spray. You use that nasal spray and you spray a couple sprays in there and it starts to get a little bit better. It starts to feel like you get a little relief, but then you go back into that environment, back into the atmosphere, and the symptoms and issues come right back. It's similar to that. If you have issues with your Eustachian tube, we have to address the underlying problem. Because if you go into a situation where you're just forcing the widening of that Eustachian tube, going back into that predicament, it's going to revert back to the same condition. You got to take care of the underlying issue so that way your overall body can heal itself. My advice is to do many things to find the right rhythm of your body. Everyone has a rhythm. Everyone has habits that they can learn and improve from. Whether that be eat more greens, get more exercise, do jaw massages, take time to stretch, get more sleep, drink more water. Just overall take care of yourself better. Lower that stress. If your job is stressing you, get another one. Do your absolute best to find your remedy into what's going to help you feel better in the end. Because like I said, it's just a little bit of this and a little bit of that, and you'll start to find healing. I ask you all to subscribe to my channel so you can get the latest, greatest health and wellness videos, motivation, yoga, and meditation. But before I let you go, I'd like to leave you with one thing. Being well is feeling well. Feeling well is doing well. Doing well is living well. Take care, everybody. Talk to you soon.